EMT Practice Tests. Part 7. 121. A 66-year-old female complains of diffuse abdominal pain and nausea. She has a history of hypertension and occasional depression. When caring for this patient, you should be most concerned with A. The possibility that she may vomit. B. Determining the origin of her pain. C. The emotional effects caused by the pain. D. An acute rise in her systolic blood pressure. The answer is A. The possibility that she may vomit. 122. The parietal peritoneum lines the A. Retroperitoneal space. B. Lungs and chest cavity. C. Walls of the abdominal cavity. D. Surface of the abdominal organs. The answer is C. Walls of the abdominal cavity. 123. A young female presents with costovertebral angle tenderness. She is conscious and alert with stable vital signs. Which of the following organs is most likely causing her pain? A. Liver. B. Kidney. C. Pancreas. D. Gallbladder. The answer is B. Kidney. 124. A 35-year-old mildly obese woman is complaining of localized pain in the right upper quadrant with referred pain to the right shoulder. The most likely cause of her pain is A. Acute cystitis. B. Cholecystitis. C. Appendicitis. D. Pancreatitis. The answer is B. Cholecystitis. 125. A 59-year-old male presents with a sudden onset of severe lower back pain. He is conscious and alert, but very restless and diaphoretic. Your assessment reveals a pulsating mass to the left of his umbilicus. You should A. Vigorously palpate the abdomen to establish pain severity. B. Administer oxygen and prepare for immediate transport. C. Place the patient in a sitting position and transport at once. D. Request a paramedic unit to give the patient pain medication. The answer is B. Administer oxygen and prepare for immediate transport. 126. Pain that is localized to the lower back and/or lower abdominal quadrants is most suggestive of A. Acute pancreatitis. B. An aortic aneurysm. C. A kidney infection. D. Acute appendicitis. The answer is B. An aortic aneurysm. 127. Pain felt at a location other than its origin is called A. Referred pain. B. Radiating pain. C. Visceral pain. D. Remote pain. The answer is A. Referred pain. 128. Which of the following conditions is more common in women than in men? A. Cystitis. B. Hepatitis. C. Pancreatitis. D. Cholecystitis. The answer is A. Cystitis. 129. You are caring for a 25-year-old female with acute left lower quadrant pain. She is conscious and alert and in obvious pain. Her blood pressure is 110/70 mmHg, pulse is 100 beats/min and regular, and respirations are 24 and unlabored. In addition to administering oxygen, you should A. Place her in Trendelenburg's position. B. Request permission to give her Motrin. C. Give her small sips of water to drink. D. Place her in a comfortable position. The answer is D. Place her in a comfortable position. 130. Which of the following is a nonspecific complaint that is commonly associated with an acute abdomen? A. High fever. B. Hematemesis. C. Loss of appetite. D. Lower quadrant pain. The answer is C. Loss of appetite. 131. A 49-year-old male presents with confusion, sweating, and visual hallucinations. The patient's wife tells you that he is a heavy drinker and she thinks he had a seizure shortly before your arrival. This patient is most likely experiencing A. Acute hypovolemia. B. Alcohol intoxication. C. Acute schizophrenia. D. Delirium tremens, DTs. The answer is D. Delirium tremens, DTs. 132. You respond to a college campus for a young male who is acting strange. After law enforcement has secured the scene, you enter the patient's dorm room and find him sitting on the edge of the bed. He appears agitated. As you approach him, you note that he has dried blood around both nostrils. He is breathing adequately, has a rapid, irregular pulse, and his BP is 200/110 mmHg. Point treatment for this patient includes A. Requesting a paramedic to administer naloxone, Narcan. B. Assisting his ventilations with a BVM and 100% oxygen. C. Asking law enforcement to place handcuffs on the patient. D. Attempting to calm him and giving him oxygen if tolerated. The answer is D. Attempting to calm him and giving him oxygen if tolerated. 133. Syrup of ipecac is no longer recommended to treat patients who have ingested a poisonous substance because it A. Has been linked to hypotension. B. Does not effectively induce vomiting. C. May result in aspiration of vomitus. D. Has toxic effects on the myocardium. The answer is C. May result in aspiration of vomitus. 134. An overdose on acetaminophen, Tylenol, will most likely cause A. Liver failure. B. Gastric ulcers. C. Kidney failure. D. CNS depression. The answer is A. Liver failure. 135. The usual dose for activated charcoal is up to G for a pediatric patient and up to G for an adult patient. A. 5-10. B. 10-20. C. 12.5-25. D. 25-50. The answer is D. 25-50. 136. After administering activated charcoal to a patient, it is most important to A. Call medical control. B. Be alert for vomiting. C. Reassess the patient's BP. D. Document the intervention. The answer is B. Be alert for vomiting. 137. You respond to a local motel for a young female who was sexually assaulted. The patient is conscious but confused. She tells you that the last thing she remembers was drinking beer at a club with her friends the night before. When she awoke, she was in the bed of the motel room. You should be most suspicious that this patient A. Is a heroin abuser. B. Is acutely intoxicated. C. Was given Rohypnol. D. Is abusing marijuana. The answer is C. Was given Rohypnol. 138. The Poison Control Center will be able to provide you with the most information regarding the appropriate treatment for a patient with a drug overdose if they A. Know the location of the closest hospital. B. Are aware of the patient's age and gender. C. Are aware of the substance that is involved. D. Know why the patient overdosed on the drug. The answer is C. Are aware of the substance that is involved. 139. A 3-year-old female ingested several leaves from a plant in the living room. The child's mother is not sure what type of plant it is, stating that she bought it simply because it was pretty. After completing your initial assessment of the child, you should A. Administer 25 g of activated charcoal. B. Induce vomiting with syrup of ipecac. C. Contact the Regional Poison Control Center. D. Immediately transport the child to the hospital. The answer is C. Contact the Regional Poison Control Center. 140. Activated charcoal is given to patients who have ingested certain substances because it A. Induces vomiting and empties the stomach. B. Binds to the substance and prevents absorption. C. Decreases absorption of poisons into the lungs. D. Is a direct antidote for many toxic substances. The answer is B. binds to the substance and prevents absorption.